Naturopath and a herbalist and a GAPS practitioner here, and I specialise predominantly in gut health and autism in particular. I have a son with autism. He's nearly 8 now, so when he was diagnosed he was close to 3, and he had a lot of the things that when you look back now definitely were autistic traits. At the time I just thought he was a nightmare of a child because he would scream all the time, he would self-harm, he would attack me, he'd attack anybody in his peripheral vision at a playground. He was very possessive of a piece of equipment, so if he saw a child that was touching this piece of equipment and he could have been on the other side of the playground, didn't matter, he would, if I didn't catch him, he'd rip that kid off the swing by the hair as quickly as he could. So clearly we weren't invited to a lot of playdates. So as a result, we obviously got more and more. Once we had the diagnosis, that was a great first start because we knew what we were dealing with. Then the next thing was to look at diet, and we had, he was a great eater. A lot of parents tell me this. He was a great eater until somewhere between 12 and 18 months, and then something changed. We had great eater, and then somewhere between 12 and 18 months, he would only eat Weet Bix. Breakfast, lunch and dinner and every meal in between. So it's that brown, carb, gluten, sugary, feeding the bad bacteria kind of foods. So that was a nightmare, and that went on for about 12 months. Eventually we moved to gluten-free and dairy-free, which was a great sort of start, and we saw improvements. And the big thing when we're talking about therapy that we found, the better his diet, the better the therapy session. So if he's had a bad meal for some reason, and then we go and try, we did it the other week, had a terrible meal the night before, we went to do speech the next day, waste of time. He wouldn't sit still, he was bouncing around, he was defiant, he wasn't listening, he was absolutely wasted $120 sort of thing. And but we find when his diet is good, excellent sessions, in fact we can get through quite a good amount of work in a short period of time. And so last year we embarked as a family on the GAPS diet, and so, because he was not easy to feed, but we thought, all right, here we go, brace yourselves. Lots of arguing, lots of fighting, lots of rewarding with the iPad, lots of tantrums, and that was just me. And then, because it was really, really quite difficult. And as any parent of a child with autism will tell you, it is, they'll starve themselves before they'll eat something they don't want to eat. My kids went on a hunger strike. We had all sorts of, I was not Mother of the Year. It was quite obvious with some of the things that would happen, but that was all right. We got through it. We broke the back of it. And the interesting thing was he was seeing therapists that had been seeing him from the beginning of the year, and some of them started saying, what's happening? He's concentrating. We're getting through so much work. What have you been doing? And I would tell them, and they would agree that gut health is really important. And so we just found therapy sessions were getting better, school was getting better, his behaviour was better, the house was finally calmer, because again, these kids rule the house, they rule the mood of the house, and if they're in a foul mood that day, look out, your day's gone to hell, it's not great. So obviously, the more we can work with their diet, the better. And for us, with everything that I did, and I was doing naturopathy, homeopathy, all the different therapies for such a long time, it just seemed that final leg of gut healing and that final GAPS diet, which we still do now, so it was, it's become lifestyle for us. It's just how we eat, and he's recognising that it's better for him to eat that way. He will know now if he has a bad meal, he'll often tell me the next day, I don't think that food was very good for me, because he'll have tummy pain, he'll have bowel issues, and they'll have that foggy brain. And it's funny, you were talking about the whole yeast producing alcohol. I often say with the alcohol, and it's all can be quite an issue, and they have that kind of we're drunk situation going. I explain to parents a lot of times, the kids who have got this poor gut bacteria, they feel hungover all the time. The head's foggy, they're very intolerant, which is, they're noise sensitive, no one's happy if they've got a hangover, and, the kids can feel that that's what they've got, and so they feel like that all the time, so you can imagine that can't be a lot of fun for them. So by healing the gut and by starting to re-inoculate with the good bacteria, which the GAPS diet really focuses on, so what that focus is to heal up the leaky gut, start putting the good bacteria back in, start putting the good foods back in, getting rid of the bad bacteria and bringing that balance back. It clears the brain, improves their brain function, it'll improve their concentration. It'll improve their ability to learn. You'll get your money's worth out of your therapy sessions, and you'll find that they'll come a long way, a lot faster. And it's really important that this area isn't ignored. We do sort of give in to them, and it's hard and it's a really long process to change any child's diet, let alone a child with autism. So it's good to work on it slowly. It's good to, do it at a time that you're feeling, that you're able to put in what you need to put in and feeling strong. Get the whole family supporting. It does become a real family thing. And often, like for us, we all did it. The four of us in our family did it, and we told extended family that this is what we're doing. So if the kids were over there, these were the foods that they could have, these were the foods they couldn't have. There was no sort of deviating from the list, and with all that support, we got really good results. And what I'm finding with a lot of my parents, that it's tough to start with, like anything new is hard. Change is difficult. But once you start working on it and you start seeing the results, you'll be driven to want to keep going, because the alternative, when you have really, really good days and lots of them in a row, and then you have a bad day, you actually are reminded why you're doing what you're doing, because you don't want to have those bad days. And the more good days you have, the more things that you can do as a family, and you can start really bringing these kids out and getting the best out of them. And, they're all going to end up somewhere different. They're all going to end up, being the best version of themselves that they can be, and that's all we can ask for, really, when you are talking about autism. And we don't know where they're going to end up. If you'd asked me 5 years ago that where I thought my son would end up, well, jokingly I would have said jail, but honestly I would have said that I couldn't see him going to mainstream school. I couldn't see him socially having friends, and I just couldn't see how that was going to happen. And it's completely changed. He's mainstream school, he has friends, he's happy, he's got a good sense of humour. And we're very lucky that, we've had some great results. So with the GAPS diet, the idea is to heal that gut, start, clearing their brains, opening them up, improving their immune system. That's the other thing. You'll find that immune function will improve. So if you have got the child that is constantly ill, or always getting the snot and the ear infections and the tonsillitis and that, a lot of that will start to improve as well. We work with the food is the primary healer in this particular program. Yes, we add in maybe supplements or herbs that might be needed to support some of the detoxification processes. I'm very lucky that I get to work with someone like Sinclair, because he does a lot of more of the biochemical and the testing and things. So together it works really, really well, and you will get really results. And it's nice to work with a doctor that's very supportive of the GAPS diet, so I appreciate that. So it is something that is, you will only have benefits out of doing it. So,
can you say what the GAPS diet actually is, please?
Yep, so the GAPS diet stands for Gut and Psychology Syndrome, or Gut and Physiology Syndrome. What it is a gut healing program, and it's broken up into 3 stages, which is the introduction phase, full GAPS phase, and coming off GAPS phase. And so it's like weaning a baby from, say, bottle to solids. We pull everything out of the diet. There's no grains. We break down the stages of the intro diet into 6 parts, and we're really introducing foods very slowly. And we're starting with broths and stocks and soups and very well cooked meats and lots of gelatinous foods and lots of probiotic foods, so your sauerkraut, your whey, your kefirs, things like that. And through each stage, you're slowly reintroducing foods. And you don't move through the stages until your body is feeling like it's ready digestively, bowel function, perhaps skin issues that may have come up have cleared, and you sort of feel ready. And then you slowly move through those phases. If you get to a point where you have a reaction at a phase, then we recommend you step back and go back to the phase before, and then you continue through until you get to a point where you're on full GAPS. When you're on full GAPS, again, you're continuing with lots of fermented foods, because you want all that good bacteria getting into your body and into your digestive system. You've got juicing for detoxification, and then no grains, of course. So it has been likened to paleo, but certainly that precursor of the intro phase is very important. It's a really important part of it, and shouldn't really be avoided unless there's no other option. And then, of course, the ultimate goal is to come off GAPS and start reintroducing a few foods, nutritious foods, so, like your hamburgers, but start reintroducing these things back to the diet. And what I say to people is you look at it as a lifestyle. It's a lifestyle choice after that. So you're actually choosing to eat the right foods to fuel your body. So it's a process, and for everyone it's different, and for everyone's time frame it's different. But generally, if we look at it as you making choices to change your life for better health, then that's the best way to do it and approach it. I think I've covered it all.
Thank you, done well.
Thank you.
And Sonia is actually a GAPS practitioner who's trained and been recognised by
Yeah, I was trained by Dr. Natasha.
Cameron. So, and remember, it's not just for autism; it can actually help with.
It's anything: autoimmune conditions, digestive disorders, skin conditions,
neurodegenerative conditions.
There's not really much. And naturopathically, we're always trained to treat the gut first. That's how we're trained, and that's what we
As
look at.
doctors, that's just an anathema.
The opposite.
It's like, here, take this product.
Yeah, so our goal is to heal the gut, and we just feel that whatever you're left with, once you've done all that healing, is, then we know what we're really doing.
So that's the question. So the aim is obviously healing the gut lining as such, and like you said, you get that healing. When you start introducing those foods back in, are you going to come up against the same sort of problems? Like I know you're not going to introduce the grains back in.
No.
Yeah,
You can do, and then what we do, if we find you reintroducing something, and after you've done a lot of that healing, and it's not sitting well, it might just be a food that needs to be avoided for you, but then you're also left with how you can go through and you find out you can eat 3 foods and you're allergic to everything else.
Yeah.
You'll find that even if you've had foods in the past you can't eat, a lot of times you can reintroduce those later.
Once the tummy's healed.
Once that lining is healed and the gut bacteria is balanced and the digestion is working. But you might find that there are foods that still will end up off your list.
Yeah. And so just one other question. Can you increase stomach acid? That was the other thing I was going to ask, where the levels are low.
Generally what I say to my patients is have some that apple cider vinegar, like the Bragg's organic apple cider vinegar, before a meal. Instead of digestive enzymes, so have maybe a teaspoon or 2 of that and a little bit of water, and just sip that 10 minutes before you eat, and that'll help with that digestive process.
The other thing is the cofactors that are important for making stomach acid were on those slides before, and that is B1 and B6. So.
Yeah.